Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen, distinguished officials of the Ministry of Health, the respected moderators and invited speakers. Welcome to our webinar series 2. In this beautiful afternoon, we welcome you all to attend this webinar hosted by the National Institute of Health Research and Development, Ministry of Health, Republic of Indonesia. For approximately 2 hours, we will gain insights and understanding of the perspective and the requirements and methods of implementing new normal behaviors. Also, we will listen about sharing knowledge and understanding on policy implementations of new normal behavior from the WHO and our regional countries, and how to balance between combating disease transmissions and socio-economic interests, a lesson learned and best practices. I would like to gently remind the audiences to value respect and courtesy of the most during our webinar sessions. And you can deliver your question to the speaker in the Q&A box if you join this virtual meeting room. And if you join from our YouTube channels, Balit Bangkels TV, you can ask your question from the chat room provided in YouTube website. So without further ado, I would like to invite the Acting Director General of NIHRD to deliver the welcome remarks and officially open this webinar. The distinguished Dr. Slamet, Master in Health Policy, I would like to invite you to talk, and I will give you the time. Pak Slamet, if you are ready now, so please start. Thank you.
Thank you, distinguished speaker, participant, ladies and gentlemen. Good afternoon to you all. Assalamualaikum warahmatullahi wabarakatuh. It is an honor for me, among all of us, to have a great event of the second international web-based seminar on COVID-19 that has the topic how to formulate appropriate policies in era of the new normal, a trade-off between COVID-19 control and socio-economic activities. Ladies and gentlemen, in current situation, we are aware that global strategy to control COVID-19 pandemic has been directed toward a comprehensive approach by implementing public health intervention such as doing more effective active case finding and case tracing, optimize healthcare services in all levels of health services, drug and vaccine development, and other alternative therapeutic method to press case fatality rate. An adequate readiness in all of those approaches will lead to a better adaptation process. Although the number of confirmed cases remain increasing globally, some countries have experienced decline curve, and currently public health choice in the addressing COVID-19 pandemic has been moving toward challenge and readiness to an adaptation stage or so-called new normal life. Key issues during adaptation stage include to ensure community compliance in health behavioral practice to prevent virus spread and to improve individual immunity against the virus as well as to optimize providing sufficient patient treatment, which require strong and effective policy support from all stakeholders. Ladies and gentlemen, through this seminar, we can share knowledge, evidence, and experience, particularly describing how policy choices in the era of new norm contribute in addressing COVID-19 control and prevention strategy. An updated knowledge and strategies regarding COVID-19 is very important for every country to control the COVID-19 experience in the tackling COVID-19 demonstrated by other countries in the region are previous lessons for global communities, including for government officers, policymakers, researchers in different countries. As part of our missions to promote local research and to connect our researchers with international researchers, scientists, and National Institute of Health Research and Development, or NIHRD, of the Minister of Health of the Republic of Indonesia, is proudly hosting this international webinar. We emphasize on policy in the era of adaptation stage of COVID-19 pandemic. We aim to gain insight on the global response and experience in facing COVID-19 pandemic and to provide and share recent knowledge, essentially to policymakers, academicians, researchers, scientists across the world, as well as to develop mutual partnership and international collaboration on COVID-19 related research and development in the future. Ladies and gentlemen, in this occasion, we believe that all speakers would like to share and present their country experience and strategies in controlling COVID-19, as well as information regarding the best policy adaptation of the new normal behavior. Finally, on behalf of Minister of Health of Republic of Indonesia, I would like to extend my highest appreciation to all speakers, moderator, and all participants to join in this seminar, important seminar. By the end of this week, I declare this webinar is open. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Dr. Slamet, for your kind welcome. Now it's time for us to start the main sessions of this webinar. Our moderator for this afternoon is Mr. Harimat Hendarwan. He is a medical doctor, master in public health and doctor in public health. He is a member of scientific committee of NIHRD Ministry of Health. Ladies and gentlemen, allow me to invite Dr. Harimat and pass these sessions to him. Dr. Harimat, now the time is yours. Thank you.
Okay, thank you, Ibu Uli. Thank you very much. Thank you to Honorable Dr. Slamet, the Acting Director General, National Institute of Health Research and Development, Ministry of Health, the distinguished guest and participant of this webinar. Good morning, good afternoon, and good evening. Of course, depending of the participants' location. We have 841 participants coming from Philippines, Australia, Russia, US, India, Hungary, and also, of course, from Indonesia. My name is Harimat, and I will moderating for today's session, and that we are looking at how to formulate appropriate policies in the era of the new normal, a trade-off between COVID-19 control and social economic activities. As we know that COVID-19 pandemic situation is still happening and we don't know when it will end. On the other hand, people have to work and make activities to fulfill their life needs. This condition brings a dilemma, especially in the limitation of the government resources and capacity. On this day, we will hear the experience from some Asian countries, such as Philippines, Vietnam, Thailand, as well Indonesia itself, and also experiences from United Kingdom regarding the implementation of this new custom adaptation in the pandemic COVID-19, hoping we will take lesson and can implement better. So today we are going to have 6 presentations. First from Dr. Roderico Ofrin from WHO, and second, Dr. Siswanto, of course, from his name we know he comes from Indonesia. And then Dr. Supamit Chung Sutiwat from Thailand, Dr. Jaime Galvez-Tan from Philippines, and Dr. Pham Quang from Vietnam. After those presentations, we will have a question and answer session. We will hold the question until the end of a presentation period, and all questions should be put in the chat books at the Zoom chat books. And then we will get the question from there and asking to the panelists. Now, I will introduce our first panelist. Our first speaker today is Dr. Roderico Ofrin. Currently, he is a Regional Emergency Director at the WHO Regional Office for Southeast Asia, WHO representative to India. He will coming with a WHO perspective on strategy for new normal behavior during COVID-19 pandemic. Dr. Roderico, please.
Thank you very much. Dr. Salamat, Dr. Harimat, Salamat Siyang. Thank you for the invitation. Let me share my screen. I have prepared a PowerPoint presentation. Can it be seen now? Okay, can you see my screen now? Is that visible?
Good, good. Yes.
Very good. Okay, thank you. So maybe I will begin with the idea of what is this new normal that we're talking about. It's a bit of a new terminology that has been put upon us. maybe the best way to look at it is describe it. Possibly the new normal is our new way of living with COVID, which would mean we would have, as we are now, trying to contain, manage outbreaks in different parts of our countries, whether it's Indonesia, India, Thailand, trying to mitigate the risks around that. And if there are outbreaks that happen, we are managing and responding. Now, in some areas within countries, it will be controlled, it will be successful, while in others it may not. However, maybe as a total, we will keep seeing cycles of outbreaks in countries. So in that sense, this public health problem, this outbreak, which is now happening all of countries, pandemic practically, will change the way we live. However, the focus should be in our basics. At the end of the day, it is an outbreak. It is a disease. It is a virus that's spreading. So if we are good with our fundamentals in public health, then the getting back to normal with all the other sectors is possible. We have to see it as a dynamic continuum. Next slide is this. This is the outline of my presentation. Give a situation overview, a bit of context, adjusting public health and social measures, which is PHSM in COVID-19 pandemic, transition to the new normal, and possibly thoughts on the way forward. You can begin with a situation overview. This is a snapshot of the dashboard yesterday with 13 million cases, 573,000 deaths globally. I think at this point, only 1 or 2 countries have not reported any case. Cumulatively, we have seen that for the Southeast Asia region, Bangladesh, Bhutan, DPRK, India, Indonesia, Maldives, Myanmar, Nepal, Sri Lanka, Thailand, and Timor, 2 of which are participating in the panel, Indonesia and Thailand, have 1.2 million cases and 30,000 deaths. As there are participants from the Western Pacific region, they have a total of 247,491 cases and 7,814 deaths. With a focus on Indonesia, we have around 80,000 cases to date and 3,797 deaths. So what is important is not to really look at numbers, it is to really look at how this is playing out at subnational level. These are summaries of national figures, of totals. It is important to go down at subnational, at local level, because that's where you will be able to manage outbreaks or the spread of COVID-19 more effectively, whether it is for improved surveillance and contact tracing, laboratory, testing, risk communication and community engagement, or caring for patients and preparing your health systems and health services around this. This is just a snapshot for us to see that Asia still carries a large burden. The context is that the rapid evolution of COVID-19 in the region over the last 6 months has overwhelmed systems across sectors. Health systems, our transport systems, industries, it's really taken over every aspect of the way we live and the way countries are governed and managed. COVID-19 pandemic highlighted the gaps and how quickly resource-constrained settings can overburden existing capacities. So although we have measured capacities for IHR, or the international health regulations, such as epidemiology, points of entry, biosafety, biosecurity, coordination, risk comms, community engagement, we have seen that very quickly each of these capacities were overwhelmed because the virus was rapidly evolving and rapidly spreading. Other sectors beyond health also had to mount a response. to optimize socioeconomic activities that were disrupted, and engage in continuing day-to-day affairs, even during the enforcement of strict public health and social measures, so that we can slow down the spread of COVID-19. Now, I think we are already in the phase where lockdowns have been ended in many of the countries. And to continue public health and social measures, it should be lifted down in a very controlled, slow, and stepwise manner based on risk assessments. I think I would keep emphasizing this. Before any area should declare an ease of lockdown, a risk assessment should be there, whether this should be partially or fully, which areas should be open, which should not be open, or continue to be locked down. Because we've seen it in many countries and many areas, many cities have recalled their opening to stop the spread, because once you open up, and there is no preparation of the population or systems around social distancing, wearing masks, hygiene stations for washing hands, then the spread is so rapid. Protection of the vulnerable populations should also be central to the decision of maintaining a very strict enforcement of public health and social measures or not, or lifting it. Vulnerable would mean the elderly, those with comorbidities, the very poor who are in very densely packed, living in densely populated areas such as slums. So these should be foremost in our minds, because these will be where mortality and morbidity will increase and spread will increase. Some measures could be lifted first where the population or individual population density is lower. That's something to think about. And again, back to the risk assessment, what is our data in terms of population density? What is the demographic around it? Are they young? Are they old? So that's how we should be weighing how we're moving into this new normal. And it could be lifted for part of the workforce, before allowing 100% of the workforce back. So if you're essential responders, essential service providers, is that also 50% workforce returning to work full-time or half-time? In my team itself, we are doing it 50%, only twice a week coming to the office. For the most part, it is working from home. So as I was mentioning in relaying the story of how we should be interpreting our strategies based on a risk assessment and looking at several data points and information points to base our decisions and policies on, some indicators we should look at for our risk assessment are epidemiologic factors, which includes the incidence of confirmed probable cases, rate of hospitalization, ICU admissions, number of deaths. These all have to provide us the base of the picture of what we're dealing with. So that gives us the vulnerability. What is then our capacity? What is the capacity of the health system? Capacity for beds, for ICUs, how many healthcare workers, stocks of personal protective equipment, maybe even now, as we are in 7th month, how many of our healthcare workers are well-trained? What is the next surge of healthcare workers? I've been hearing many countries now reporting of healthcare workforce fatigue, but there is no team B, if you so to speak. So where are these capacities that will have to move us to provide health services in the medium and longer term? What system needs to be set up for that? Public health capacities. Practically, we always refer to this as our surveillance and contact tracing capacities. How well do we detect, identify, test for a new case? How well do we isolate? Do we have quarantine facilities and public health response teams to be able to manage if there is a cluster of cases in a particular locality and keep it to a cluster versus having it spread across the community? Availability of effective pharmaceutical interventions that makes this virus and this pandemic very difficult to fight because there are no specific therapeutics or vaccines. And that's where the whole global community is coming together, trying to find an effective or test for at least an effective therapeutic and of course a possible vaccine. To minimize the resurgence of COVID-19 cases, there are points to be considered. One is that, well, going back to normal, living life in this new normal, is that COVID-19 transmission has to be controlled to a level of sporadic cases or clusters, where you can trace every case and contain them. That's practically what we want to achieve. And it is possible. Thailand will provide the presentation. It'll be interesting to hear how they've managed to control the pandemic in the context of Thailand and keep that curve flat. I think it's more than 50 days now since there's been no local transmission. At the same time, work is coming back slowly. Sufficient public health workforce and health system capacities should be in place. So those indicators that we were looking at in terms of a risk assessment, these are the kind of outcomes we want before we can say, yes, let's reopen, let's ease our measures in terms of lockdown. Outbreak risks in high vulnerability settings are minimized, as mentioned, in urban areas where living conditions are tightly packed, whether they are residential buildings, as we now see in Australia, or huge slums, like the one in Mumbai, where even in such conditions, there is success in terms of implementing the whole principle of detect, trace, test, isolate, and care. Other points to be considered, that preventive measures are established in workplaces. Every possible point there should be either alcohol rubs or sanitizers, so that the spread of the disease is controlled by frequent cleaning of hands. Everyone should be wearing a mask. But while at work, at the same time, observe that the workplace is not so closely packed, especially in recent years. Most of our offices are open plan. Manage the risk of exporting and importing cases from communities with high risks of transmission. So it's also to understand information from, well, a neighboring province, a neighboring city, a neighboring country, and share that information. And that's possible through the IHR National Focal Points Network, where you can be sharing this information quite regularly so that collaboratively countries can reduce their risks, aware of their risks, and be able to manage.
We only have 3 minutes.
Yes,
3 minutes
sure.
more. Okay, thank you.
I'm almost there. And last is that communities are fully engaged. We have come to a point that this response to COVID-19 should be owned by the public and the population, not just by the governments. It is a responsibility of everyone. So we have developed for that a risk communication strategy with which we're working with many of the ministries of health. There is also an Asia Pacific guidance group around this for risk communication and community engagement. What is important is to relook into the scope and implementation of IHR. It is a crisis, I know, but we can leverage investment in our core capacities for IHR so that we're able to assess risks and set up a surge of a response for all the basic public health measures. As to the point, as we are responding, we are strengthening our capacities so that that cycle of possible more outbreaks are ended earlier. As this pandemic demonstrated, the fundamentals have to be in place, very good risk assessment, so we have robust planning, establishments of systems for all aspects of preparedness and response, whether it's surveillance, laboratory capacity, managing high threat pathogens. So it's really to look at the whole stream and scope of capacities that's there and planning for it and training human resources for it. In-country mechanisms and systems for regular risk identification, mapping, and risk are key to reducing the risks. So base our policies, our SOPs, our regulations on very good analysis of very good data. In country, it's also looking at leveraging your local manufacturing capacities. Many countries have this, whether it's PPE or medical devices or vaccines or therapeutics, or collaborate with countries together, such as what's there for the Solidarity and Unity trials or the COVID vaccine facility initiative. Maybe last, continue with business continuity plans for health and non-health sectors as using projections from risk assessments of what a COVID-19 outbreaks may look like at subnational level. And if we're able to manage that, we are able to mitigate socio-economic impacts of future events. Lastly, the new normal does not mean we are going back to business as usual. It's very clear that what we need is to strengthen the fundamental systems of public health. What we are communicating to the public, like wearing a mask or washing hands, is based on evidence. What we will be communicating to the public or policymakers or finance and budget ministries to invest in hospitals is again based on good data. However, what we have to do what works. Let's not think about making things complex. And that means keep physical distance, wash our hands more frequently, and cover our nose and our mouth where appropriate, and wear your masks. If that's the time I have, thank you very much. We can take questions later. Over to you, Dr. Harimat.
Terima kasih. Thank you very much.
Terima kasih banyak.
Yeah, you're welcome. Thank you very much, Dr. Roderico, for its very important presentation. I note one most important statement. Currently, there are no COVID-19 specific therapeutics or vaccines. Dr. Roderico also mentioned some requirements in adjusting public health and social measures in COVID-19 pandemic. In principles and when feasible, measures should be lifted in a controlled, slow, and stepwise manner. This assessment is very important. So protection of vulnerable population should be central in the decision to maintain or lift measures. Some measures could be lifted first where the population or individual density is lower, such as rural versus urban, small, medium versus large city, and small stores versus shopping malls. And the last, the decision on adjusting public health and social measures should be based on a risk assessment, epidemiological factors, healthcare capacities, public health capacities, availability of effective pharmaceutical intervention. Thank you again, Dr. Roderico. And now we move on to the second speaker, Dr. Siswanto, who will be presenting challenges in the implementation of new normal behavior in Indonesia. Dr. Siswanto is a former Director General of National Institute of Health Research and Development, Ministry of Health, and now he is the Policy Analyst Expert at the Ministry of Health. Pak Siswanto, silakan Pak, time is yours.
Yeah, thank you, Mr. Harimat. Distinguished speaker and all participants of the international webinar. So I would to talk about the challenges in the implementation of new normal behavior, I mean, in Indonesia. So as the opening remark from the acting DG, that's the issue on how to balance, yeah, how not only to balance, I think the issue is how to promote both the COVID-19 control and the social economic activity in such a way that we can control effectively and economic activities still running is the important issue, I think, not only in Indonesia, but all over the world, I think. Yeah. So my talk basically is covered 4 issues. The first is just to summarize the WHO perspective on COVID-19 control, and then how is Indonesia policy, especially in new normal era, and how is the implementation, and then how is the way forward. Next slide, please. Next slide, please. Oh yeah. So as Dr. Roderico explained, that due to the speed and scale and severity of the and also the societal and economic disruption of the COVID-19, and then it's very important how to make better strategy and also more operational management. And WHO already published the guideline, and this already explained by Dr. Roderico, but I would focus on how to to do more operational management. So I think that's very important, how we do the better coordination and planning, and then engage and mobilize community to limit the exposure, and then to improve test and testing and isolate for the cases already found, and then improving health system. And then the last thing that is very important is how to combat the transmission in such a way that we can achieve at the state of low level or no transmission, and then we move to the new normal. I think that's a very important issue. Next slide, please. So I will explain on how is Indonesia strategy on the COVID-19 control. So I just try to make use of McKinsey concept. McKinsey concept basically is 7S, but I modify before the 4S. The first is the structure. In Indonesia, we have in national and then provincial and also district, we have national task force and also regional task force on COVID-19. Of course, this task force is supported by the health system in each level. And then the strategy, we have the slogan actually, unite against COVID-19. I think that's very important slogan, very important saying, So, and then from the unite against COVID-19, basically we try to unite multi-sector, private and media on how to, to combat, to battle against COVID-19. And in terms of health sector, there is important risk communication and then surveillance and response, and then national lab strengthening, also strengthening of the health system. And then in terms of how to manage the system, so basically there are a number of important points. The first is the common system. The common system here in Indonesia is coordinated by National Task Force on the COVID-19. And then information system, that's very important. Information system basically is the synergy between the Ministry of Health and the National Task Force, because the data of the surveillance basically is the sources is from the Ministry of Health. And then the risk communication, this one is the role of the Ministry of Communication is very important, very important. And then testing system, now we successful to improve from around 25 lab, now is about 160 laboratory that capable of testing of PCR for COVID-19, and then also the improve the case management. And all of this, we try to achieve our target. Actually, our target in terms of epidemiology, we try to achieve what we call with the effective practitioner number less than 1. Yeah? And that's the one of the parameter that we can move to new normal actually. Yeah. Also supporting by a number of in the upstream. Yeah. For example, is establishment of the community resilient. Yeah. And now in Indonesia is emerging what we call with resilient village for COVID-19. Next slide, please. And then if we take a look of the policy trajectory in battling of COVID-19. So in Indonesia, the first cases is in March the 2nd, but actually start from February, we already made the guideline of the COVID-19 control and prevention, and now it's under revision of the 5th revision. Yeah. And then from that, as 1 week, 1 week or 2 weeks later, we make a number of intervention like strengthening national lab, and then the determination of referral hospital, also strengthening the preparedness of the all health facility, including health center, yeah, and non-COVID hospital. Yeah. Also the implementation of the prevention of transmission, like stay at home. We have hashtag of stay at home, hashtag work from home, and then wearing masks, and also hand washing and distancing. And on the April the 3rd, the Minister of Health and then launching what we call with the large scale on social restriction. In bahasa we call PSBB, pembatasan sosial berskala besar. So that's the important policy, yeah, for combating the spread of the disease. And then in the May 20, we try to ease the social restriction by publishing the Health Minister Decree on guideline of working in office and industry. And then in the middle of June, try to make the policy of new normal. So that's the trajectory of the policy make in Indonesia. Next slide, please. If we talk about the cases across the province, basically about 70% maybe of the cases is centered in Java and Bali, yeah, and the rest of course in outside of Java and Bali. So here is actually if we focus on Java and Bali, actually that we can decline the cases in a slow down manner, and that's very important. Yeah, next slide, please. If we take a look at the epidemiological trend and also the rate of transmission here. So in the left side, you can see here the absolute number, also the average, of the cases. That's basically still improving. And we take a look of the effective practitioner number. Yeah. So we can see here is basically undulating. So like multiple waving, something like that. It's mean that we haven't success actually on how to slow down in such way that we can go back in the as Dr. Roderico said into the normal life actually. Yeah. So the problem here is how to lower this graph. I think there is three points, three key important. The first one is ensure that every individual will implement of the tight health protocol. That's very important. And second is strengthening surveillance system, and the last one is strengthening healthcare system. But for my point, number 1 and number 2 is the most important. Otherwise, there is overburden in the healthcare system. Yeah. Next slide, please. It is the the survey done by Saiful Mujani, research and consultant. My point here, that the attitude of the community, of the people in Indonesia, basically they see that the COVID-19 maybe I mean, some people thinking that there is no risk, something like that. For example, we can see here for motorcycle, for policy of motorcycle only for single rider, and then 32% still do not agree, for example. And then the other, like co-checks, and then prohibited for person, 27 do not agree, and so on. So it means that, there is actually a gap or incongruent between knowledge and then the attitude, also the practice. Even though the knowledge is higher, but the attitude and practice could be a little bit lower. Yeah. Next slide, please. And we all know that new normal basically is changing the behavior, and then in such way that socially and economically to be active, but still keeping the tight protocol. My point here, we can change this behavior by using what we call re-engineering, social re-engineering. So I think we can make use of the hidden theory of restructuration. So in hidden theory, the new agent that will changing the norm, the value and the belief, and then the changing the community action, and then the changing of community perception, and finally make changing of the structure. In the structure, of course, cover of the norm, value and belief, also the culture. It is very important. So I focus here that the traditional socialization or traditional education is not enough. So the important thing is how we make a more programmatic social re-engineering. That is the important point on this. Next, please. And in Indonesia, yeah, that's only one of the just illustration of the guidance of the new normal in education. Yeah, that's in the video. Yeah, next, please. Just an example. That's the step-by-step of new normal in Indonesia for economic recovery. I think it's similar with the other country, but basically, in the phase 1, basically it's strict, only for industry and service. But until phase 5, we open for the other socio-culture event or something like that. Yeah, and then every step actually we try to make an evaluation. Yeah, to make a risk assessment, but it's not an easy, because the social, large scale of the social restriction, the unit is on the district and city, also on the provincial, because now Indonesia is under under decentralized system. That's also the challenging also. Yeah, next slide. If we take a look at the practice, that's just an illustration of the traditional market. We can see here, like in the upper picture, there is a seller using face shield and also mask, but behind there is not wearing the mask. So there is a still variation. That's why I need the picture below, law enforcement. Yeah, next slide. Then that's another issue, as we open the office, also the industry, and then the road in Indonesia, also the railway station, that's full with people gathering, and then now from this, the government make two shifts of the worker, put in the office, also also in industry. So basically, what I want to say is we make an evaluation from every step, of our policy. Yeah, next slide, please. Nah, that's another cluster, that I want to let you know, the participant. There is health facility cluster, also the, training participant cluster, also workplaces, and also religious catering cluster. So it's need, to make continuous improvement by making use of the cycle plan to study action. In this cycle, study or risk assessment become the important thing on how we try to ease or why try to use more tight. That's actually it's like like we riding the car when we we make a more brake and then M.Kes and so on. Yeah, so it is very important. Yeah, next slide please. That's the survey from the Imperial College of Imperial College in London. Yeah, so just to compare between the ASEAN country, Indonesia is the in terms of wearing the mask is the second least likely to wearing the face mask. I mean, and what about hand sanitizer? The hand sanitizer in Indonesia is the lowest, the lowest of using hand sanitizer. It's mean that that's what I want the practice. Sometimes the practice is not in line with the knowledge. Next slide, please. And so that's the end of the slide. So the conclusion that don't make a conflict between the control also the economic activity. We try to promote both, and how that's the important thing, how to make better policy. And then new normal protocol for all socio-economic activity have been established actually, but not being implemented in disciplined way. That's the important issue. And then expected new behavior have not been to be new culture. So the key is how to institutionalize new behavior become new culture. So for the recommendation, there are 3 points, as I already mentioned actually. The first is improving people discipline to do new behavior of the new normal, including face mask and then keep hand sanitizer and also avoid physical avoid gathering, also to keep distancing. Also the strategy actually is how to to institutionalize that, not only in terms of education, but the most important thing is empowering the community through hidden theory. And the second is strengthening surveillance, of course, for 3T, test, tracing, also treat. And the last one, if number one, number two still fail, of course, we must strengthen our healthcare system. But hopefully, number one and number two is the most or the key feature of the COVID-19 pandemic. Thank you. Yeah, the last one. Yeah, the last one. Also, thank you with the slogan, unites against COVID-19. Thank you very much. Yeah.
Thank you very much, Dr. Siswanto, for the nice presentation. I think the presentation will enrich our discussion later. And as we know, the positive cases of COVID-19 in Indonesia are still volatile and tend to increase. But on the other hand, some people facing problem to fulfill their life needs. Consideration between economic and health need is very difficult to harmonize, especially in the situation when the public literacy of the COVID-19 is still not good. Actually, in the last part of his explanation, Dr. Siswanto mentioned that interesting recommendation to be discussed. Thank you again, Pak Siswanto. And now we have the third speaker is Dr. Supamit Chunsutiwat, Sawatiton by Dr. Supamit. He will be presenting on Thailand experience in COVID-19 response and effort to attain new normal. Currently, he is a senior advisor in CDC Thailand, member of National Vaccine Committee, and also member of National Advisory Committee on Immunization Practice under NVC, WHO Sheros ITEC member, and chair of WHO CRCCPA. He also has long working experience in the Ministry of Public Health of Thailand, as well as in the WHO, including as a WHO temporary advisor, which attending the consultative meeting on cooperation for production of DTP and DTP-based vaccine in the Asia and Pacific region in Bandung, Indonesia in 1994. Dr. Supabit, now it's your turn, please.
Hello.
Okay, good. We will accept your presentation here.
Okay, very good. Thank you very much. Good afternoon, Dr. Harimat and everybody, all distinguished participants. I'm very pleased to join this webinar to share experiences and thoughts from Thailand as we are facing the same challenges and difficulties with the current pandemic COVID-19. Before I go on, I would like to ask for the permission of Dr. Harimat, as you are the moderator, for me to take off this mask so that you can hear me more clearly.
Yes. Okay, thank you.
I can assure you I'm alone in the office.
Yeah,
so
more.
Transmit my virus to other people. The title of this webinar is very challenging, and I have to confess that I may not be able to really meet the progressive view of this conference on how to adapt to the new normal behavior. But I will take a little step back to share our experiences on meeting an immediate challenge of trying to transition from intense COVID-19 control to normalize everyday life and to restore economy in Thailand in an overview. I have a few slides. I need the assistance of the Secretariat to change my slides. First slide, please. Okay. First, I will briefly review. Next, please. Yes. I will briefly review on the situation of COVID-19 and along with the national response up to date. As you may know, Thailand has been responding to COVID-19 since early January, following the virus introduction by travelers from Wuhan, China. The early cases were confined to travelers. Soon, local cases were seen among Thai people having had contacts with travelers. And in February, the number of cases in the Thai people were rising. And clusters of cases were first seen in Bangkok and the perimeter, and then spreading to other cities and towns in other parts of the country. Crowded places like boxing theaters and pubs were identified as main sources of the outbreak. A good number of cases were found in the Thai people returning from tour or religious activities in other countries. As Bangkok became the epicenter in the early phase of the outbreak, on the 22nd of March, the Bangkok governor ordered the close down of several activities and businesses that were considered to pose risk of COVID-19 transmission. The Bangkok lockdown had an unexpected immediate impact. Tens of thousands of workers moved out of Bangkok en masse within a week to return home in different parts of the country, as most of the workers were daily wage earners who suddenly became jobless from business closed down. And this, in effect, could have accelerated the spread of the virus to other provinces. In response to the rising number of cases and the threats of further spread, on the 26th of March, the government declared the state of emergency, mounting countrywide response that included closing borders, closing of places and activities, limiting public gatherings, and promoting use of face masks and hand washing and social distancing for the whole country. Under the lockdown, the measure that is considered to have significant impact on interruption of outbreak is the control of international travels. Under the state emergency, most international travels are banned. Entry is allowed for some purposes, such as diplomatic, security, and humanitarian missions, and repatriation of Thai citizens. Individuals who are allowed entry are subject to 14-day observation in state quarantine to ensure absence of infection. You may see in the slide, in April, the outbreak was slowing down, and in May, daily counts continued to reduce. And since early June, no local infection has been detected. And today, Thailand is marking the 50th day without detection of local infection. However, a small number of infected individuals are detected in international travelers or returning Thai people who are observed in state quarantine. Those who are tested positive are moved for isolation in hospitals, although most of them have mild symptoms or are asymptomatic. Next slide, please. Next slide, please. In an overview, public health response to COVID-19 in Thailand is based on three-pronged strategies. First, the interruption of virus importation. This was initially based on entry screening of travelers from affected areas. But as COVID-19 became pandemic, the measure eventually resolved to closing borders to all international travels since the 26th of March, and travelers who are allowed entry are subject to virus test and 14-day quarantine, as earlier mentioned. Second, surveillance and control. COVID-19 surveillance is built upon influenza and emerging infectious disease surveillance that has been built over the past decades. Surveillance and rapid response teams, or SRRTs, serve as frontline responders in outbreak investigation and control in the community. Capacities for RT-PCR testing of COVID-19 has been scaled up, similar to what Dr. Siswanto has mentioned happening in Indonesia. Now, our national laboratory network, composing public and private laboratories, is able to accommodate the daily need for testing. And very importantly, hand washing and use of face masks and social distancing practices are promoted as key safeguards against COVID-19 at community level. The practices are extensively implemented with good public compliance. And the third strategy is clinical management. All the positive cases are admitted for treatment in the hospital under infection control. Severe cases are given antiviral drug and ventilation support. And so far, we have seen the case fatality of 1.8%, relatively low. And the care for the Thai cases is financed under the Universal Health Coverage Scheme, free of charge. Besides health interventions of the COVID-19, the response also benefits from other supportive functions. Next slide, please. And these include, for example, the national EOC that can coordinate and command effective multi-sectoral response, the active law enforcement, especially of the Communicable Disease Act, which grants considerable authority to the Provincial Disease Control Committee and the governor to mobilize resource and tailor control interventions to suit the local situation. And the active role of health volunteers and community leaders who work in parallel with local health authorities in support of public communication, surveillance and control, and humanitarian missions. Next, please. Next slide. Next slide, please.
Excuse me, this is a delay, Dr. Supamit, yeah, in transmission.
I will continue as you're changing to the next slide. From our experience, we observed that early response is essentially the game changer. If the integrated national response were not initiated early enough, we believe that our limited capacities and resources would have been overwhelmed and overrun by the snowballing effect of the outbreak, and we could have been in much worse situation. The lockdown has contributed significantly to the interruption of virus importation and control of virus spread in the country. However, it has extensive and profound impacts on the people. Millions of people have become jobless overnight. Many people are daily wage earners having no or little reserve. They can hardly sustain daily living without job. So the government has to allocate a very large sum of budget to support millions of unemployed people for income compensation and to support falling businesses with various assistance schemes. And the country is shifting into negative balance in economy. And this is very unfortunate. And many countries are facing the same situation. Next slide, please.
Excuse me, we still have a problem in connection here. Okay, good now.
Can you still hear? Hello, can you still hear me?
Yes, we can hear you, but I think we have difficulties in the connection of the slide, maybe in the transmission of the slide.
So I will continue verbally.
Yes, yes, of course.
So under this challenges, the government has to take steps to restore economic situation and social stability, initially by easing the lockdown, in full awareness that this will be done at the risk of re-emergence of outbreak. As the slide is not here, I'm showing the slide that since early May, a number of daily new cases is coming down. And until now, 5 consecutive phases of lockdown easing have been implemented. And I have another slide that describes some detail of the stepwise lockdown easing. I will just describe verbally and briefly. On the 3rd of May, the government announced the first phase of lockdown easing, and the following activities and businesses were opened. First, the food shops, but only for take home. Some departments in the department store, including supermarket, food, essential utility, beauty salon, hospitals and clinics, golf courses, games and sports in open space, and public parks. Please continue to the next slide. Okay, next please. And one more click. This is animated. I'll go step by step. Next. At first we ordered, please stop with the first phase. Yeah, a little way back, we had the declaration of state of emergency on the 25th of March, and then curfew was declared on the 3rd of April. And with these, we had lockdown interventions. And on the 3rd of May, the first phase easing of the lockdown was declared with these activities as shown. Next, please. Another click. The second phase was declared on the 17th of May, and the following activities and businesses were allowed. More departments in the department store, marketplaces, institutes for the elderly and the invalids. Movie making was also allowed with small crew of less than 50. Convention center and meetings in the hotel could be opened with limited audience. Beauty clinics and manicures were open. This is very important for the ladies. They have to be beautified. Museums could be open. And next, click. Yeah, we extended the state of emergency one more time. And next, please. And on the 1st of June, we had the third phase of easing. And with this, inter-provincial travels was allowed. Schools and education institute could be open for short-term teaching. The whole of department store could be open. And recreation places like the zoos and movie theaters could be open. Next, another click, the fourth phase, 15 days later, curfew was lifted and more activities and businesses were allowed. For example, schools and education institutes could be open fully. Convention centers for usual activities could run. Nurseries open. Movie making with larger crew up to 150 could continue. Spas and traditional massage could be open, but not yet for modern massage parlors. And next, please. The last phase of easing was announced on the 1st of July. And we've been 2 weeks of this easing. All schools could be open. Department store could open all departments. All markets, trade centers could be open. Pubs and bars and karaoke could be open. And now massage parlor could be open, including the tea shops. In any case, while easing the lockdown to resume activities and businesses and travels, which is very essential for for the return to normal situation. The process has to be done with great care. Next, please. Next slide. As we are aware that reopening favors virus transmission, we've seen in many countries such as China, Japan, Korea, Australia, that easing of lockdown is almost always accompanied with return of outbreaks. So close disease surveillance and close monitoring of preventive behaviors must be conducted in parallel with the easing. At early signs of virus transmission, the people must be well informed and advised to raise guard. At certain level of transmission, for example, when the daily new cases exceed a number, say 50 or 100, certain containment or lockdown measures may be restored, and response may be focused, localized, or generalized as guided by surveillance finding. And we are facing two testing incidents. Just this week, there are two incidents in two provinces that are raising public concern over easing of the COVID-19 control. In an incident, some of you might have seen on the newspapers, if you follow Thailand newspapers, even though online. In one province, a group of military personnel on mission from a Middle East country were allowed landing at a military airport in the province and granted temporary stay at a hotel under quarantine. Some members of the group went outside the hotel against the rule and take short break in town. On departure, the troop was tested under routine protocol, and one member of the troop tested positive, although he was asymptomatic. Questions have been raised in the media about the pitfalls in our quarantine and control process. And as a result of this incident, the people in that affected province are caught in frustration. Some are in panic. The economic situation in the province is shaken and the people get disheartened. Worry about the potential resurgence of the outbreak is quickly spreading to other provinces where connection could be traced. Taking these incidents on the positive side, they may serve as tests of public awareness, tests of public reaction and effectiveness of existing prevention and control measures while we are trying to attain new normal. They help identify weaknesses and gaps in our surveillance and control systems and in public communication so that we can timely address and ensure the effectiveness of our response when we are faced with the larger challenges. I'm going to the very last part of my talk. At this moment, in an overview, we can foresee, please go back. Some more points to stress here. We are now aware that while we are trying to keep COVID-19 at bay at the manageable level with the best of our effort on surveillance, prevention, and control, and with people in high guard against the virus, and we need to adapt and learn to live our normal everyday life and work in the new normal way. And a good example is this webinar. Now we are holding meetings online. And this mode of meeting is getting more convenient and efficient with improving technology. Many of us are working from home, as Dr. Ofrin just mentioned. We are shopping more online. We are ordering food more frequently. with home delivery instead of eating at the restaurants. Teachers and educators are adapting to give class online. As a major mode of teaching, schools are taking shifts for classroom teaching to enable the practice of social distancing. Certainly, businesses, this sector are facing harder challenges and difficulties. People in the business, either big or small, will have hard time coping with the challenges. We in health sector will also have to do our best in collaboration with concerned partners and with the people to adapt and work for the health of the people in the practice of new normal ways under the challenge of COVID-19 and other upcoming health security issues. And Dr. Siswanto emphasized on the practicality of our new practices, new normal practices. I totally agree with you. I will stop my talk here. Thank you.
Thank you, Dr. Supamit. We really apologize for the inconvenience. According to Dr. Supamit's presentation, public health response to COVID-19 based on three-pronged strategies. First, preventing importation with the initially entry screening, eventually closing borders, and surveillance and control. And the third is medical care. These efforts must be supported by supportive factors such as active law enforcement, Communicable Disease Act and other laws, flexible universal health coverage program, and active role of health volunteers and community leaders, and also the innovative application of IT and role of media. Khop Kun Krap, Dr. Supamit, and thank you very much for the excellent presentation. Distinguished guests, we have now our fourth speaker, is Dr. Jaime Galvez-Tan, Manggandang Hapon, Dr. Jaime. He will presenting the Philippines' experience in preparing a new normal during the COVID-19 pandemics. Dr. Jaime is now president of Health Futures Foundation and also professor of the University of the Philippines, Manila, and executive director of the National Institute of Health Philippines in 2000 and 2005. Before we beginning the presentation, I want to remind for the participant that we need to be putting the question in the chat box. Now, Professor Jaime, time is yours, please.
Yes, terima kasih. Terima kasih, Dr. Harimat.
Yes, thank you.
And Bapa-bapa, Ibu-ibu, Sudari-sudara, selamat siang, selamat sore. Good afternoon, everyone. As Harimat saying, magandang hapon. Sawadee-kap.
Sawadee-kap.
Okay, and thank you so much for this wonderful opportunity for me. And I'd like to say a special hello to Dr. Roderico Ofrin, my student. Thank you, Roderick. Nice to see you. Okay, regards to Art Pisigan. Okay, so let me start this Philippine experience in preparing for a new normal during the pandemic. Thank you. So my outline will be COVID-19 updates, how the Philippines is coping, and we have the new normal, and of course, I'd like to say immediate actions for the Philippines as well as for action and the global alliance against COVID. So an update, our total number of cases as of yesterday is 58,850, and the total number of deaths since we started monitoring January 30. January 30 was the first case coming from Wuhan, and the second and third case also from Wuhan. However, the fourth and fifth case were already Filipinos, but travelers from other countries. So our death rate is now roughly 2% of those infected have died. And average case per day is 298, although right now, since the loosening of the quarantine, by the way, we're now 122 days of the quarantine. This 298 still on an average, but recently we have already 1,500 to 2,000 cases a day, and I will explain that later. And average death still is only 8 per day, okay, compared to many countries, okay. Our epicenters are really the large cities, particularly Metro Manila, a total taking up 29,000 cases. Metro Cebu, particularly only recently, and Southern Luzon, south of Manila. So this, as you can see, there's a big difference between the large urban metropolis and in Southern Luzon. Before we had in Mindanao, but it was effectively controlled it well. So in January, we only had one laboratory, one PCR laboratory. And now we have 82. And our total number of health facilities is 1,900. But occupancy, we're still able to cope up with the number of cases, with severe cases. So far, we only have 49% occupancy. Okay. Now, what are the consequences of the pandemic and the lockdown? I think I did not hear so much. So far, there is an increase in mental health disorders, anxieties, worries, fears, even suicide. A lot of hopelessness and helplessness, not only among the poor, but even among middle class and even the rich. It has no barriers. Again, we've seen a lot of violence against women and children, physical, emotional, verbal, and even sexual abuse, and mainly from very small houses, particularly among the urban poor. And the unattended cases of cardiovascular diseases, cancers, and diabetes. And I can explain that later on why, unfortunately, the pandemic has really focused so much. The health system focused, I would say, 90% of their attention to COVID, while, in a sense, certain neglect of cardiovascular diseases, cancers, and diabetes. Now, how are we coping up? No? Even up to today, the health leadership is still overwhelmed, and the health bureaucracy, despite being awash with gas. We're awash with gas mainly because we have been benefiting since 2014 out of the cigarette taxes and alcohol taxes, no? Similar to what Thailand had in Australia. So since 2014, we have quite a substantial amount of money. However, this was not used, as you can see, no? In the right places. And I can explain that SARS, for example, SARS, bird flu, it did not really affect the Philippines. Unlike Thailand and many other countries, Malaysia or the Mekong River region, I think you learned a lot, Thailand, from the SARS epidemic and the bird flu. But since the Philippines did not suffer from SARS, did not suffer from bird flu, or even the Asian flu, we were not really prepared now, despite 2014, wherein there was already money. So 6 years that the health system has been funded very, very well. Just imagine, when I was Minister of Health, I only had 5 billion, and now it's 200 billion. Yet, it was the COVID overwhelmed the leadership, and there was chaos in logistics and supplies, in buying protective equipment and in buying many other things, like even hand sanitizers. So really, Philippines was caught flat-footed. Although we have very good disaster risk reduction due to earthquakes, typhoons, but not, of course, ready for a pandemic. So again, as you can see, it is Metro Manila, Metro Cebu. It is an urban pandemic. And we are 81 provinces, but in 20 or 30 provinces, not a single case. And very, very few in the others. It's really these two areas right now, Metro Manila, Metro Cebu, that are really bearing the brunt of an upsurge, the second upsurge since May. Okay. Again, the urban poor are the most. The most difficult is really, are you going to have people dying of hunger, or are you have people dying from COVID? But as you can see, very few are dying from COVID, and more are dying from other diseases, which is really the challenge. The poor living conditions in slums, aggravated by climate change, flooding that is already happening because the monsoon is upon us, as well as the small houses. I think all of us know this, whether it is Metro Bangkok or Jakarta or in Bali, we have these so-called slums or informal settlers, and workers mainly in the unprotected informal, very much similar to Thailand and Indonesia. And the severe effects of provision and utilization of basic health services, particularly for the urban poor. They are the ones truly suffering in terms of unable really to cope. I just like to put that across. Now let's look at the new normal in the Philippines. What is interesting is that before we were relying on importation of the protective personal equipment. And right now, both government and private sector and communities, this is interesting, have come together to come out with our own production locally. And so far, we are now well equipped compared before. Remember, the Philippines as of today had the most number of doctors and nurses infected in the world and the most number of doctors and nurses dying from COVID. Two of my best friends, my classmates, had COVID. Fortunately, they're alive, by the way. They have survived. They were one severe and one was moderate. So even community women are now producing the face masks all over the Philippines. And private sector, alcoholic beverage factories, instead of producing alcohol, which was banned during the first 100 days, they went into another business of alcohol, ethyl alcohol production. Okay. And in terms of new normal, interestingly, because the cities are overwhelmed, there is an emergency hiring. Our Ministry of Health has been calling for an emergency hiring of doctors and nurses. Even those who just finished medical school, they were not able to take the license board exam, are now mobilized and considered already full-fledged doctors as well as nurses. Okay. And then, interestingly, provinces and cities are leading the way, particularly model cities. We have model provinces outside of Metro Manila, outside of the Metro Cebu, that are showing the good practice and best practice. And because one of them, just to say, is to designate non-COVID hospitals so that pregnant women delivering, again, heart attacks, hypertension, diabetes, cancers are taken care of in these non-COVID-19 hospitals, and there are COVID hospitals. But in Metro Manila, however, and in Metro Cebu, this is not being followed yet. Here, I would like to say part of the new normal of the Philippines is wherein we have LGU, means local government, because we have a decentralized health system. Civil society organizations are really non-government, and they are non-profit as well as the profit sector in the business have now come together and assist community-based system. Okay, so the shift is moving from a hospital-centric response to a local government, civil society, business sector response. So right now, all these local governments, civil society, business sector are building community-based isolation facilities in every village in Manila, Cebu, and also outside. And there are home-based caring mechanisms, particularly for asymptomatic and mild cases of COVID positive. Now let's look at the immediate future, how we will respond with all these policies. One thing we have learned, and that this has to spread some more, is the return of inspired leaderships. And like, what is an inspired leadership? When leaders at all levels, national and local governments, mayors, governors, and even community leaders all appear hopeful and optimism and accepting innovation, new adaptive responses. However, this is what we see, that the successful cities and the successful provinces are showing inspired leadership in mobilizing. The real control of COVID lies in the community. This is what we're showing right now. And there is a show of Filipino solidarity and coordination. We call this in the Philippines, all of government and all of society coming together. We do have the same structure as Thailand and Indonesia. We have an interagency national task force, provincial task force, city task forces against COVID. But there is nothing like where community, civil society, and business sector play a big role. Now, what else we need to do is a national unified communication plan using behavior change. How do we really, the challenge of behavior change, just like everywhere. I think what I hear from Indonesia and Thailand, and I know Vietnam did a very good behavior change communication. I hope our colleague from Vietnam will share this. And really a national coordinated comprehensive. I will call it like COVID-19, what every Filipino can do to stop it. There's some action, and this will involve celebrities, influencers, animation artists mobilized. And this, I get this inspiration from Thailand, and all media mobilized with standard messages. I mean, it goes without saying what everybody's saying: hand washing, physical distancing, and again, hand and a lot not touching the face, etc. Again, some actions. So far, we're doing smoke-free health promotion. And there is even a new law that will come out, vigorous campaign on hazards of smoking, vaping, by the way, and secondhand smoke. And we know those who are smoking and vaping are more vulnerable to COVID-19. So we are considering a temporary ban on the sale of cigarettes, particularly in urban poor areas. And in nutrition, again, what is nice is that we do have communities that are establishing community kitchen just to ensure that everybody is fed. This is an interesting phenomenon, and accelerate the access for safe water and sanitation, especially among the poor. So I'm going to my last few slides, and I would really like to have an ASEAN. I hope we will have more of this and expanded beyond 4 countries. Thank you so much, Indonesia, for taking the lead. I hope you will lead us, I mean the whole ASEAN region, to support and encourage one another. For this seminar truly is very encouraging, and the sharing has been very, very good. And we are in a global village. We all need each other. So I hope that through the ASEAN Secretariat based in Jakarta and the United Nations, gather 1 representative per country. Let's have these online conferences regularly in different ways, wherein we share global lessons, evidence-based policies and action, and share latest scientific discoveries. I know WHO should be doing this globally, but I'm waiting. Or China or the United States. But ASEAN, let us show we are one. Yes. And again, let me end with a quote that I also thought about, that we are in extraordinary times, demanding extraordinary thinking and extraordinary action. Terima kasih, Kapkun Kap, and come on, Ban from in Thailand, in Vietnam. Maraming salamat in Filipino, and just visit my website, jimmygalvestan.com. And I say to God be all the praise and glory. But if I forgot to mention one thing, indeed our lockdown from March 15 to around May was very good. No, it really slowed down. But when our overseas Filipino workers, I just like to say that the Philippines has 11 million Filipinos working outside of the Philippines. What happened in May in the loosening up was at least 300,000 came back. And that is where there is a big, again, number of cases. No? That's why the cases now are reaching, on the average, as I was saying, from 200 cases a day, now it's 1,500, at times 2,000 cases. Okay, let me put that again. Thank you so much. Terima kasih and maraming salamat po. Thank you.
Okay. Thank you, Professor Jaime. Thank you very much for this interesting presentation. And I absolutely agree with you. We are in extraordinary times, demanding extraordinary thinking and extraordinary action. I think at the last presentation, Professor Jaime asked for an Asian and a global alliance against COVID-19, establish support and for one another. We are in a global village. We all need each other. Led by the Asian Secretariat and or the United Nations, gather one representative per country in a Zoom or online conference that meets at least once a week, and share globalization learn, evidence-based policies and action taken, and share latest science discoveries on COVID-19. Thank you again, Professor Jaime, and salamat. Okay, for the fifth speaker here, firstly, I would like to ask Dr. Pham from Vietnam. Do you connect with us now? Dr. Pham? Okay. Okay. I think since Dr. Pham still in the plane, I will change him with Dr. Dian Kusuma. He is from the Imperial College London, United Kingdom, and he will presenting the COVID-19 and new normal in United Kingdom. I think this is also important to see the new normal in a country representing the European region. Oke, silakan Pak Dian. Oke. Please, Pak.
Ya, terima kasih. Can you see the slide?
Yes, excellent.
Thank you, Dr. Harimat and Dr. Slamet and Dr. Siswanto. Thank you for the opportunity to share. My name is Dian Kusuma. I'm currently a research associate at Imperial College Business School, the Center for Health Economics and Policy Innovations. I will be sharing my experience from the UK, where I've been living for 2 years now. In terms of the current situation and the new normal that me and my family are experiencing day to day. So this is the latest on vaccine tracker. So there are over 150 efforts, research groups around the world are trying this, and There's one approval, but it's a very limited use. It was approved by the military in China. What's more, wide potential for wider coverage is the ones in phase 3 now. This includes the ones developed by Oxford University here in the UK, in Brazil. But with all the process they have to go through, they are aiming for at least next year. So what that means is that until next year, we will have to live in a new normal. Now, let me share the current situation in the UK. If we look at this, this is the daily confirmed cases by countries. I'm showing some of the highlighted countries. So this is the daily confirmed, yeah. So we can see that which countries here have been able to bend the curve. We see countries like the UK, Germany, Italy. All of them have gone through the flattening the curve, yeah. And on the other hand, and we see here Thailand has been doing very impressively. And then we also have Indonesia and Philippines here, which is still increasing, not flattening yet, and India as well. So scary. So this is to show you that when other countries where the global trend or some regional trends are showing that we're opening up, we're easing the lockdown. What's really important is, as speakers from Thailand mentioned, that what's really important is the assessment per country, because each country has a different situation, as shown by this one. Indonesia and Philippines are still going up, but other countries are already flattening the curve. Now, comparing UK with the peers in the Western Europe, it's showing, this graph is showing the cumulative cases. So they keep adding up each day. And it seems here that France, Germany, these are the France and Germany, they are the quickest in flattening the curve in Europe. And UK is, out of the select countries, are among the slowest in terms of flattening the curve. That's to give you a perspective of how UK is compared with peers here in Europe. Now, COVID in the UK, almost 300,000 cases now, and unfortunately, over 45,000 have died. It's in terms of number of cases, it's number 10 in the world. In terms of number of deaths, is the 3rd in the world. Now, this is similar to the previous chart, but focusing on the UK, starting from March all the way to yesterday. And this is really showing us the daily confirmed cases, but using 7-day average. And then you can see here that the country has successfully flattening the curve. Now, I will show you a little bit in the next couple of slides how the lockdown easing and the new normality come into which part of the curve. Now, in terms of, because of the need for test and trace for the new normality, easing lockdown and everything, the UK around 1st of March was already successfully, the government claims that they have met the target of doing 100,000 per day. And a month later, on 31st of May, 200,000 target a day has been met. So that's very impressive. And the lockdown itself is actually very early here. It's around 23rd of March. And you can see that from the from the curve is actually here still lower. But even this, many critics have mentioned, many criticism is that it's not soon enough. It should have been earlier March. Now, this is the R numbers. Siswanto presented the R number for Indonesia, fluctuated. This is the R number in the UK by region and nation. On average is below 1, but there are regions in the southwest that is still, there are some parts that is still above 1, yeah, the reproduction number. So this is in line with the flattening the curve, R number less than 0 and all that. However, there are still few hotspots, yeah, and these are the areas where the positive test per 100,000 is still high. The latest we are seeing now is this area, the city called Leicester, and in Leicester, when everyone is when all part of England have been eased in terms of lockdown, Leicester still under lockdown. So it's local lockdown, citywide lockdown. Just because based on the assessment, based on the cases that they have there, they just have to do it. And also there are other hotspot areas as well. And this is the number of deaths 7-day average. So it's also going down as we flatten the curve. Now, this is another thing that could be very useful. I think there's already research groups are doing this for Indonesia and potentially for other countries in ASEAN as well, is to assess the excess deaths. So comparing the death between March, April, and May with the 5-year average. And so this is to show you if the gap between the excess death, in this case, this one, and the official COVID deaths is very high. So that could, give an indicator that potentially, there was an issue with testing and all that. And then, in fact, the potential death is actually higher than reported by government. Now, this is steps of the adjustment for social distancing measure. This is steps to ease the lockdown. We also see this from Thailand experience. So we see here, as soon as the R number less than 1, then the government start thinking about opening up. So there's really, really important to have the valid R number and then to be reviewed over time. And this is just to share with you the milestone in the UK. So this is, you've seen this chart before. On the 13th of May, this is the first step of easing lockdown. So this means that in the UK, work, particularly the sector that cannot work from home, they're allowed to work. But they, in going to work, they are advised to avoid public transport. And also they are advised to wear masks in enclosed spaces. And also in terms of park, you are free to exercise, because during lockdown, you only are allowed to go out once per day for exercise. Now, after this, in the first easing out of the lockdown, you are free to exercise as many as you want, but you have to keep social distancing. So you have to be alone, not in group and all that. Now, in June, that's the second step of easing. You see that the number of daily cases is going way down before the government is easing out again. Now the government then says, okay, nursery, primary school can reopen, but with all the social distancing, hygiene, and all that in place. And then also in open spaces, in parks, instead of only 1 or 2, up to 6 people from different households can come together. And then car showrooms, outdoor markets can open. And the keyword here, I think this is similar to the one in Thailand, is the outdoor part. Yeah, showroom, many of them are outdoor, in there, and then also outdoor markets. The indoor markets, supermarkets are a bit later in the easing. And also those in shield. So in the UK, maybe also in other countries, the elderly and people who are vulnerable, they are shielded to go out because of the risk of the infection. So now, after the 1st of June, they can go out with families. A little bit more on 15 June, shop selling non-essential can reopen. So bookstores, toys and all that. So you see again, the daily cases is keep going down before the next step of easing lockdown. Also zoos and outdoors, again, outdoor attraction open. The closed one, indoor attraction would come later on. Secondary school that can already provide support face-to-face, and then face is mandatory for public transport. So going to the bus, you have to wear a mask. Hospital staff and coming to the hospital require masks as well. Now, at the latest, on the 4th of July, this is on Saturday, this is the fourth step in easing down. So the government changed the requirement for social distancing from 2 meters to 1 meter if 2 meters is not viable. And restaurants, pubs, and cafes can reopen. And museums, cinema, so those are the indoors now, right? Museum, cinema now can reopen. Places of worship, wedding. Now you see here, it's already very low in terms of a number of daily cases compared to what was before, around 5,000 per day, right? And then people can also meet outdoor. Now, a little bit in the new normal, you can get a free test if you had symptoms with NHS, the National Health Service provider. Some without symptom can get test too, but if you get a symptom, you get a free test. Just come to the NHS. So that's really, really important because that removes the disincentive for people to come and to get tested. Now, if you're as part of the trace part, if you are tested positive and you're contacted by the NHS, you will be asked, your friends, where have you been recently, and all that. So that's part of the trace part. And also following these advice, you are told that if you've been in contact, if you get a symptom, you do this. If you do not get a symptom, you do that. So there's a clear guidelines like this in the NHS website, and then also some of them are even advertised in YouTube. Now, these are the part of the things that part of the new normal is that phone and video call appointment. So when you want to do consultation with your doctor, you go online or you use a video call. So this is to do social distancing and to reduce infections. Yeah. Now we're moving towards another part of non-communicable disease. So the WHO in Europe, and this is mid-June, so last month. So this is recent. People are still thinking about how to proceed with non-COVID services like NCD, even in the new normal. So things like using technology, using telemedicine. I gave you an example of the phone and online consultation under NHS and all that. Yeah. And then, so this is an example from Scotland where they post this video on YouTube for people to do cardiac rehabilitation at home instead of they have to come to the clinic, something. So this is another a way that doing it in England, the drive-through services, the new normal at the trust. So this is, while we are familiar with drive-through for COVID testing and all that, this is drive-through for NCD services. So you see here, people are accessing services, blood tests, cardiac device checkups, just from car. So they just come to the clinic and they will have this setup here, and then there will be as much as possible for the social distancing and other new normal measures. Now, I mentioned to you that mask is already mandatory in bus and public transport, and starting from July 24th, it will be mandatory as well in shops and supermarkets in England. And then this was similar potentially with the research from Imperial. So UK is actually a bit low on the lower end in terms of wearing proportionate people who say they wear face masks. So Singapore is the highest, and we have Vietnam here, China, Italy, and Spain, Germany are also on the higher end. Now, in terms of working from home, this is sort of the unprecedented trend that people are experiencing with the new normal. A lot of people are working from home, so there's no point of buying, very expensive house or flat in London. So they go outside of London because they are, they can do work from home, and that also came same with job. So in order for them to do the job working from home, so they can stay in Newcastle, for instance, but still, traveling to London maybe once or twice a month. In the past, before COVID, that's unlikely, but now it's very likely. Another one that I'll share with you is universities in the new normal. These are 2 universities in the UK, at least two of these have mentioned that they will do online, full online for the next year. Cambridge University and Bristol University. Other university, I think at like Oxford and other at Imperial as well, they are sort of still figuring out ways of having a hybrid version of this, part online and part also in person. So those are the things that the UK is doing. Unfortunately, I'm not able to cover everything, but would be great to have discussion and share experience from other countries in the Southeast Asia region as well. Thank you.
Okay. Thank you very much, Dr. Dian. And I note from his presentation, in addition to the steps taken by the UK, WHO Europe has also stated NCD prevention and control at core of COVID-19 response. Among others, engaging NCD healthcare staff in planning COVID-19 response strategies, using technology to provide online information on exercise and wellness classes and healthiest recipes, using telemedicine, prioritizing community level services, and prioritizing NCD patient and healthcare staff for COVID-19 testing. Thank you, Pak Dian. And now, before we continuing the discussion session, I will ask once again to Dr. Pham. Do you connect with us now? Okay. Dear distinguished guests, now we entering the discussion session. We have a lot of questions in the chat box, but due to the limitation, the time limitation that we have, I will select one question for each speaker, and I will be directly to the panelists that was addressed by the question. First question coming for Dr. Supamit and Dr. Siswanto. Dr. Supamit, in your opinion, can do Indonesia adopt Thailand policy to application of new normal era with Indonesia unique characteristic? What is the most important effort made by Thailand so that the new case of COVID-19 become 0? I think this is very interesting question. And for Dr. Siswanto, how get solution about now? Some people see new normal life same as a normal life. What an effective action has been taken to make sure people implementing new culture? Please, Dr. Supamit. Dr. Supamit. Okay. Pak Siswanto, maybe you first.
Thank you, Pak Harimat. So I think that's an interesting question there. So I agree that some people, especially in Indonesia, I don't know in Thailand, there is a misperception. So people perceive that, new normal is back to normal. So I think that's wrong. Yeah? That's wrong. So I think all know that what is new normal? New normal basically is the changing of behavior, changing of behavior in tight health protocol in such a way that we still have, the doing of social activity in such a way that productive, but still keeping the control of the COVID-19 spread. So in this case, in this sense, I emphasize that we need risk communication in more transparent and more, educating people on how to improve the literacy of the people. And then after that, the thing that is very important, as I already, emphasizing, is how to make, social re-engineering of the implementing, or in anthropologic view, we call the institutionalizing of the new behavior to be new culture, And we have a lesson learned from this. Family planning in the past basically is, that's a social re-engineering. Also the, in bahasa STPM, sanitasi total berbasis masyarakat, community, based total sanitation. That's also how to make social re-engineering by stimulation of the community, and then basically focus on the community empowerment. So that, and then the sanction is not from the government official, but the sanction is from the community itself. That's what we call is by sedimentation of the culture. So that's very important. So I would say that it's need of programmatic, structurally, and then systematically and massively of how to change the people behavior. Thank you, Pak Harimat.
Okay. Okay, thank you, Dr. Siswanto. And second opinion coming for Dr. Roderico. Why the policy of rapid test checking of the COVID-19 is getting wider? In his opinion, this is no longer necessary to do that. It is important to implement protocol as a new normal behavior. And coming from Adam Moffat here, my idea is to thin viral load by using alcohol mandatory around households to everything fingers touch, especially main doorknob, nationwide household and public office. How is your opinion? How is your opinion about that? And how should the existing EXIM policy regarding medical, biomedical instruments, and pharmaceutical and medical supplies be modified? Thank you, Dr. Roderico.
Thank you. Thank you for those questions. First is on the rapid testing. We need to continue to do rapid testing because, as we have said, the basis of our risk assessment is the EPI data. We have to know what is the burden and the number of cases. Now we have issues around the kind of rapid tests that are being used. What is latest also is rapid antigen testing. If we turn positive where there is a higher sensitivity of the test, if you are positive with the antigen, then you have the infection. That is important for us to be able to plan whether your measures of controlling the outbreak are effective. And then that can become the basis whether you ease your restrictions for lockdowns or closure of certain businesses or public places. So that's one. The other thing is I didn't understand the issue on alcohol spray. Was that?
Yes. That is coming from Adam Moffat. My idea is to thin viral load by using alcohol mandatory around households to everything finger touch, especially main doorknob, nationwide household, and public office. How is your opinion?
Well, in the homes, it is just frequent hand washing that you may do. having alcohol rubs right at your fingertips when you get out of the toilet is important. But at home, it's also cleaning those surfaces. So you have to cleaning those surfaces regularly. It is more in public places, well, like the workplace, where that should be also readily available. Every time you finish even at home, you know, when to wash hands, you have to wash as frequently as you can. So when you come out of the toilet, it's best that you grab toilet paper or towel paper, open the doorknob, get out, and then throw the piece. There are certain behaviors that can be modified to do this, so that you don't touch dirty surfaces. But in most workplaces, these can be installed everywhere, so that when you step out of the toilet, there is an alcohol rub or spray that you can put. But at the same time, there are certain behaviors that you can do to not touch the doorknob itself and have a paper to turn it. I mean, there's several ways, but the idea is not to touch dirty surfaces, because that's where you may get the infection. But also not then to touch your face. So it's a whole cycle of healthy behavior for hand hygiene. Thank you.
Okay. And how about the third question, Dr. Roderico? How should the existing extreme policy regarding medical, biomedical instruments, and pharmaceutical and medical supplies be modified?
Modified in what sense? Is it for fast track of approval? Because that's one big thing that regulatory authorities can do. If there is a new technology, it is to fast track approval of new therapeutics or diagnostics with proper review. So that's one policy change that can be done. For essential supplies, I'm not sure what policy change is being asked for. But in the larger piece, it's regulatory authorities having a fast track way of approving. I think Indonesia has that also in place, and they're putting something in place for vaccines.
Okay. Thank you, Dr. Roderico. Dr. Supamit, you have a question. In your opinion, can Indonesia adopt Thailand policy to application of new normal era with Indonesia unique characteristic? And then what is the most important effort made by Thailand so that the new case of COVID-19 becomes zero? Please, Dr. Supamit.
Hello.
Yes.
I'm sorry, I left a meeting for a short time as I have to join another meeting, but I returned just to attain this question. The question is very interesting. As I mentioned, we've been in one way lucky that we have started our response early enough, because we have limited capacities, even though systems have been established, but capacities were limited. At the time we started our response, we had the number of cases at the level of 100 when we started the lockdown, and after that, the number of cases, the rise was slowing down, and finally coming to touch the baseline. What we felt was most promising in our response is the ability to control the international travel. And it was effective enough to interrupt the importation of the cases and the virus. For the internal process of surveillance and response to interrupt and control transmission in the country, I felt, and many of us believe, that the extensive practice of use of face mask and social distancing and hand washing, hand sanitation have done their job in keeping the virus transmission very low. So with all these, I think that all countries can try to maximize the capability of the measures. Whether or not Indonesia can do the same, probably Indonesia can do better than Thailand if the cooperation of multi-sectors and the leadership of the government are strong enough. In Thailand, we are trying to do our best to keep the efficiency of those measures to the minimum. And we are counting a lot on the awareness of the people. We hope that we can sustain the awareness and the practice of hygiene and social distancing among the people. And the second question, can you repeat again, please? Well, probably I might have covered those points.
What the second question is, what is the most important effort made by Thailand so that the new case of COVID-19 becomes zero?
The new cases have been zero.
Yes.
But we don't expect to keep it to be able to keep it at zero level or in the future. We expect that we foresee that we may have some cases, but we hope that we can keep the level of transmission low enough that we can handle. And what is the level of our acceptance? It is the level that our health capacity can handle number of cases. Around 100 or so per day. The most important effort that we are making is in two ways. First is trying to prevent importation, and second, trying to sustain the practice of sanitation and social distancing. And all this has to be supported by strong leadership of the government, strong cooperation among multi-sectors, and awareness of the people. So public communication will be very important. Over.
Okay. Thank you, Dr. Supamit. And the next question for the Prof. Jaime. Prof. Jaime, what become challenge and benefit from lockdown policy for the archipelago country? Prof. Jaime? Okay, I go to the next question for Dr. Siswanto. Regarding the programmatic social engineering, would you like to give example if this program has already been implemented currently? And the second, in many areas, since the new norm and large-scale social restriction, the case increases. How is your opinion?
Yeah, thank you, Harimat. So, as I already explained, that Indonesia have a lesson learned of how to make social re-engineering. The first lesson, I think, is a family planning program. Family planning program. Family program is one of the program in the past is very successful on how to make a social re-engineering in such a way that you know uh, to get enough and so on, and so on. And that's another lesson learned is another lesson learned is community-based total sanitation. That's one of the other project in Indonesia that is very successful on how to make social engineering by community empowerment. And the other question is what is? Oh yeah, in many area, one local government implementing a large scale social restriction, but the number of new cases, could be no, I mean not declining, but instead of declining, it's increasing. Why? Why? So the answer is, of course, to what extent the community or the people can implementing, in a disciplined way regarding social, regarding large scale of social restriction. Yeah. So from our survey done by Badan Litbang, also by Saiful Mujani, research and consultant, that's the problem is the discipline of the people. Yeah. So I would say that it is in the future, it is very important, to know, I mean, how to implement the existing structure like, dasawisma, and then rukun tetangga, and then RW, village, and so on, and then that structure, how to make use to be institutionalizing of the new behavior, in the new behavior. So by using the hidden structuration theory, you can use agent, and then the new agent could be in the people itself within the community, and then try to change the action, and then change the pattern of action, and then sedimented into the new culture, something like that. So that's an important way how to change the behavior in the community. Thank you, Pak Harimat.
Dr. Siswanto. And the last question for Professor Jaime. What become challenge and benefit from lockdown policy for archipelago country? Okay.
Okay, hello again.
Hello.
Terima kasih. And well, Philippines, Indonesia are both archipelagic compared to Thailand. Well, of course, archipelagic also in terms of UK. But I would like to say one thing we have learned lesson is the travel among islands. If it is restricted, there will be no transmission. Particularly what has happened now is many people, there was a campaign, and I think this is a lesson learned. There was a campaign for government to allow Metro Manila people to go out into and return to their original islands. But this brought more infections to the other islands, okay? So that's one lesson, and it's been temporarily stopped. The other one is now our overseas Filipino workers. They also lost their jobs abroad in other countries and are now coming home, but they have to return. And in their return, when there are no official quarantine and they do not follow, they return on their own, they spread the disease in the island. So I think the only way to do it is really not to allow or have strict quarantine measures for those arriving. And in the Philippines, The arrival, just like Indonesia, I suppose, will be by boat. Our airline services have not really come back, and it's only really by traveling by boat to the island. And in places that have stopped the transmission or increase in infection, because they were very careful in limiting people returning to the islands, okay? And just maintaining, for now, status quo until there is really a change in the behavior of most people traveling. Okay, so that's what I like to lessons learned from the Philippines in terms of the archipelagic situation. Terima kasih.
Okay, thank you, Prof. Jaime, and thank you for all speakers. And finally, we are at the end of the event. We apologize for not being able to present a speaker from Vietnam, maybe in the other time, next time, maybe. Thanks to all the participants. I think this is a rich and very important webinar, not only for our understanding of the COVID-19 public health and social measures, but also to get experience from other countries that might be a lesson learned or even a best practice to be implemented. I think it is time for me to wrapping the webinar results. I started with a warnings from the WHO. New normal doesn't mean that we are going back to the business as usual. And strengthen the fundamental system for public health is necessary. We have to do what works, keep physical distance, washing our hands more frequently, and cover nose and mouth where appropriate. In entering new normal, a few things must be done. Improving people discipline to do new behaviors in new normal era with the strategies to institutionalize new behavior to be new social structure, and strengthening surveillance system to ensure better treaty, test, tracing, and treat, and strengthening healthcare system, strengthening risk mitigation and infection prevention procedures in health facilities. Also, public health standard effort must be supported by supportive factors such as active law enforcement, Communicable Disease Act, and other laws, flexible universal health coverage program, and also active role of health volunteers and community leaders, and innovative application of IT and role of media. Lastly, I ask permission to close this event with a thank you, terima kasih, to the panelists, Dr. Roderico Ofrin from WHO, Dr. Siswanto, Dr. Supamit Chunsutiwat, Professor Jaime, and also Dr. Pham Quang, and Dr. Dian Kusuma. Also, many thanks for the participants, the organizer, and see you again on another occasion, and hopefully this pandemic quickly pass. Thank you very much. Bye, and assalamualaikum. Now I resubmit the event to Bu Uli. Please, Bu Uli.
Thank you, Pak Harimat, for your kindness being our moderator for these sessions in this afternoon. Honored guests and audiences, I would like to remind you about the evaluation form. Kindly not to forget to fill it and give your full name and valid email address for certificate purposes. The evaluations form can be accessed through the website shown in the screen. You can scan the QR code, or you can type the address in your browsers. And this webinar can be accessed after the end of this webinar until 3 hours. 3 jam. Until 3 hours ahead, about around 6 p.m. in this today, Jakarta time. So we thank you again for attending this webinar session series number 2, and we will have another webinar series number 3, and stay tuned, and it will be held around August, and please stay tuned in our website for further informations about the next seminar. Thank you. And now we ask to leave this room and see you again in the future. Bye-bye.